You're listening to the MER-Mates podcast, the Marine Science Research podcast.
In this captivating episode, we sit down with an innovative chemist and esteemed professor to delve into his groundbreaking work in environmental research.
Join us as he shares insights from his career, exploring the fascinating world of transdisciplinary teamwork and the analytical tools he developed to detect emerging contaminants.
Discover how he tackles the complex issues of emerging compounds and antimicrobial resistance, shedding light on the challenges and dreams of his research.
Plus, get to know him beyond the lab as he reveals some of his hobbies that fuel his passion for science.
Don't miss this chemically stimulating conversation.
Today, we have a special guest joining us, a seasoned expert in the field of chemistry. Since earning his PhD in 1993, he's been a professor at the Department of Analytical Chemistry at the University of the Basque Country. Over the years, he's led a cutting-edge research group focused on developing analytical methodologies to tackle environmental challenges and advance ecotoxicology. It's no surprise that in 2020, he took on the role of coordinator for the CTA Master's Programme, which is all about toxicology. Plus, he's been involved with the station since day one. Let's give a warm welcome to Dr. Nestor Etxebarria Loizate. Welcome, Nestor.
Welcome for having me.
Welcome, Nestor, and thank you for your time. First question is, how are you and how was your day today here?
I'm pretty well. I must confess that since we are back from the holiday vacations, it's becoming very hectic, but still in good mood.
September's always a bit tough, really.
It's
agitated for us too.
Yeah, it's terrible.
Mm-hmm. And what did you have to do today, for example?
For example, I'm coordinating the Master Vivas of CTA Master. We have around 19 students that are presenting the work today and tomorrow. And they are nervous. The panel members are scared, and then the students are even more scared.
That was us a week ago, really. 2 weeks ago, a week ago.
The only one who looks calm is me.
Setting a good example.
Maybe experience, no?
Maybe.
Well, you might not know, but Sam and I, we are biologists, so no chemistry experts, but we will try to keep up with your knowledge. So something we are curious about is what made you pursue your career in the field of chemistry, and how did you end up with ecotoxicology and environmental challenges, which brought you here to the Plencia Marine Station?
Well, I have to do a kind of a step back.
Okay.
Get
Absolutely.
some air and trying to explain what happened many years ago. Well, I did chemistry. I studied chemistry because it was at that time, a kind of multidisciplinary science. It was not so focused as so basic as physics or mathematics, and still there was unemployment at that time as a chemist. So I did chemistry. In chemistry, I chose analytical chemistry because it was very related with the laboratory, with instruments. And then the planets align. I did what is, let's say at that time is the Tesina, what is the bachelor work in Basque. It was one of the first ones that was done in Basque in the faculty in chemistry. And next year there was a position in the department for teaching in Basque, and that was the window that was open in that moment, in that right place, and I was there. So I was hired by university and I started teaching and doing my PhD and doing it. So I started very, very, very young in this business, and at the beginning, I must confess that our instrumentation level was very poor. But I decided to go abroad. I did a postdoc in Belgium, and once I came back, I was, let's say, dressed with new ideas, with new research lines, and then we started doing more analysis of contaminants, but not metals, because metals was something that we were doing before. We started doing organic compounds. I had a very good PhD student at that time, and we opened a new research line, and it was consolidated because we had at that time the collaborations with biologists. They required our analysis. We were interested in effects, and then this is a kind of long story with biologists. And when this place was opened, I'm living here, so it was just a good chance to work here with everybody together.
So you're living in Plencia?
In Gorliz, yes.
In Gorliz, all right. I think I've sometimes maybe seen your car driving past you in it, obviously.
Maybe.
Yeah, maybe. So let's get the timeline right. You start at the University of the Basque Country with your Desina,
Yes.
and then you started as a professor, and you did your PhD in Belgium.
No, I did postdoc.
You did your postdoc in Belgium.
Belgium.
So apart from this, regarding your work and education, have you also have to be other places abroad, or have you only been at Belgium?
When I started with a PhD, I had the chance to spend a short stage in Sweden, Stockholm, because my both supervisors did the PhD there. So we had the connections. I was interested in doing other things and go outside. At that time, Erasmus Mundus program was not invented.
Right.
So I took the chance to spend 3 months in Stockholm. It was fantastic. And then, well, I had no any other chance to go during my PhD stay period to another university, so I took the revenge with a postdoc. And postdoc was 2 years, and since then, well, you know much better the scenarios with other research groups. It was at that time enough.
All right.
But we can say that you've always been attached to the university, so
Yes.
To different research lines, or as a teacher also, as a professor. But focusing on your research lines, what sort of projects are you working in nowadays?
Well, with my colleagues in chemistry, we are working in the analysis and nowadays of emerging contaminants. Emerging contaminants are all those contaminants that are not limited by any regulation or monitoring regulation or industrial regulation or whatever. Basically, they are pharmaceuticals, personal care products, and microplastics, these kind of things. And these are challenging because the concentrations are very small. They are easily transformed in other byproducts. So since we have the instrumental ways to measure them, we measure them, and they become interesting because they are toxicologically speaking, they are very active. So then the connection with biologists and toxicologists is somehow closed, and we work together. That's basically the framework of the research. We are now in many other research groups, many other research lines. For instance, we have one that includes all the research groups of the PA in One Health vision of the estuary of Plencia, including economics, people from ecology, engineering, physics, etc. That's a challenge, but it's a good excuse to have everybody working in just one project.
So you mentioned the word of multidisciplinarity,
Yes.
or transdisciplinarity, which is something that is really the PA is really working on it, or things on those ideas. What is it like to work with other people or other disciplines?
It's challenging, but it's also very rewarding. It's true that it depends on the attitude of the people. I mean, there are people that are very reluctant to work with other colleagues or, let's say, people from other disciplines. But I found the colleagues here at the PLIE very keen on working together with other scientists, with other disciplinaries. And once you start, you get the reward and you follow with new projects. I think that's it's the personal attitude sometimes which focus you in this direction, or making you, maybe with these guys I won't work any longer. But in this case, I think in PA it's interesting, it's rewarding.
Well, we don't want to put you in a tight spot or anything, but
Maybe.
since you've worked with different branches, different, you've economics, all of this, is there any specific group you don't enjoy as much working with?
No, not at all. No, you have to gain the people. I mean, when you gain the connection, you're connected with people, then everything goes smoother. It's true that sometimes we have the problem of languages and customs. We do these things in this way, and other people do things in another way. And you have to, let's try it again. Let's try it again, and then you understand what is his or her points, and they understand our points, and then we can work together. I'm very curious, so I find it very interesting to work with other people.
Oh, well, that's good to hear. We're glad. So, like that, you don't have to say anything you don't want to say.
No. It's true.
You've mentioned emerging contaminants, and we're no experts on them. We know a bit that there's pharmaceutical, personal care products. But is there any product that would maybe surprise our listeners that is an emerging contaminant? That it wouldn't be expected, maybe, and could have toxicological effects?
For instance, caffeine. Caffeine is one of the most likely found emerging contaminant. For us, is we can talk caffeine or cotinine. Cotinine, you know what cotinine is the metabolite of nicotine. These are the signatures in environment of anthropogenic activity. If we find any of them, we know that there is a kind of discharge of a wastewater treatment plant, or there are people around, because there are no other sources of caffeine or nicotinine. And above certain threshold levels, they can be toxic.
Okay. And what impacts could have on the environment?
Well, in most of the cases for the emerging contaminants, this is still unknown. Okay, but think what happens when you drink 2 or 3 coffees more than usual. You cannot sleep well. But think on fishes or other organisms when they are exposed to high levels of caffeine for a long period. Maybe they have behavior problems. Maybe they are reluctant to eat. Maybe they don't take the rest as they should, and they become vulnerable. So that can be a problem for organisms, individually speaking. If we take a community and we have a continuous exposure to caffeine and plus caffeine, other drugs, you have a lethal cocktail there.
So continuing with the emerging pollutants, we thought of doing a game or a small quiz. I don't know if it's going to be easy, but
it's not going to be easy for us.
So we want to combine the emerging pollutants with your hobby, one of your hobbies, which is the jazz.
Yes.
Are we correct? Yes? I think we are. You're a fan of jazz?
Yes.
Okay, good. I'm glad.
So we have a list of different emerging pollutants, and you have to associate them with a jazz artist, a famous one.
Okay.
We don't know much about jazz, so maybe you can invent
say many.
So whatever I say will be nice.
Correct. Yeah, exactly.
So we will start with the one you already mentioned, caffeine.
Caffeine is heavy metal.
Heavy metal?
It's more heavy metal.
More like modern jazz, yeah.
Yes.
Okay, fair enough. What about cotinine?
cutting in can be kind of a jam session in a pub with not much people, and you're smoking as a hell.
All right.
Microplastics.
Microplastics. This should be something like a very modern, just let's say, pat metheny.
Quite nice. What about? Can you give me an example of a pharmaceutical substance?
I have.
You have one? Okay.
I have many. DDT, pesticides.
Pesticides, something that stinks.
Bad jazz, maybe.
I don't like, well, maybe not in jazz, but I don't like this reggaeton and things like that.
Okay.
I agree.
Maybe one last one. Bisphenol A.
Bisphenol is an old classic, so let's put a name of Van Morrison or something like that.
Oh, quite nice. Turned out nice. A bit scared of that. So we're going to change drastically the topic. Not very drastically, but recently I watched a documentary and you appeared in it, and you were basically taking some water samples in the water treatment plant here in Plinthia, I believe. So what were you looking for? Because was it organic pollutants anymore, or was it something else?
No, they were organic pollutants. We are monitoring the wastewater treatment plants here in Biscay from time to time in different projects, and we are monitoring the emerging contaminants because that gives us the picture of the consumption of this or the exposure to these contaminants. We are also monitoring with other colleagues. We are not doing the analysis. We are collecting samples. We are measuring illegal drugs as well.
Right.
So that gives us a good estimation of the consumptions of illegal drugs, because the other way of estimating the consumptions is through pools that sociologists make and questionnaires, and you have to run many questionnaires and to have a very large amount of people answering to this questionnaire, and then sometimes it can be doubtful if they are saying the whole truth. And it's true that we are doing this, and this now is very popular in the media because it has been published recently. One of the reports of the Spanish Observatory for Drug Consumption, that we have a very special feature in the Basque Country regarding the consumption of illegal drugs.
So we can see that wastewater treatment plants give you an honest answer of.
It
the
gives
habits,
it gives a kind of average view of what happens. Yes.
And if we focus on the Bilbao and the surroundings, what are the wastewaters telling us about?
Well, it's a very large story because you see many drugs that are, pharmaceutical drugs that are linked with hypertension, with mental health, with cardiovascular problems. So there are many of these pathologies that you see many commercial drugs directly in wastewaters.
But
Plus cotinine, caffeine, amphetamines, methamphetamines, cocaine, whatever.
Oh, so there's a lot of recreational drugs in
Yes,
these
especially in
waters too.
weekends.
Especially in the weekends. And is
And maybe summer.
maybe summer.
Well,
Is
in
there-
Bilbao you don't see that. We can see maybe here in small villages where the population is rising too high in summertime and is very low in wintertime.
And regarding these recreational drugs you're finding in the water, I understand you're working with more than one wastewater treatment plant around Europe, or at least you have that knowledge. Where are they partying the hardest?
The patterns are different because we have here a very clear peak of consumption of amphetamines, but we see average values of other drugs. And you go to Catalonia and you see there a high consumption of methamphetamine, not amphetamine, methamphetamine, and average consumption of other drugs. There are some reports. We are working in a Spanish network, and we are doing this. Last time was let's say 25 capitals in main cities in Spain that was sampled 1 or twice in a year. And they reveal a kind of picture of what happens in Spain, and there are differences, and in Europe as well. But answering to your question, maybe Netherlands.
Maybe Netherlands, yeah.
Maybe the Netherlands, maybe South Sweden, Germany. Well, that's something that we could have spent.
Yeah. Anyone that like not also maybe not just like recreational drugs, but like the drugs in general that you find in the water. Is there any pattern that you found curious or not expected?
Well, it's difficult. We have to have the picture of all the data. It's not so straightforward to say the patterns, no? But we see that, for instance, regarding the pathologies that we have a kind of old people. So the average of the people in the Basque Country is rather old. They have a kind of clinical framework that explains what we see in the wastewaters. Maybe in other communities, in other countries, where the sociological distribution of age and people is different, maybe the picture is different. It's difficult, huh? And we need too much data to digest.
Continuing a little bit with that topic, well, not only drugs, but in general all emerging compounds, those can end up in wastewater treatment plants. And how effective are those plants removing some sort of drugs or pollutants or whatever, and that could not end up in the water, in the estuaries? Or
well, we have to think that most of the wastewater treatment plants that we have all over Europe were technologically designed something like 25, 30 years ago. If you want to see, check what is going on in UK nowadays. In UK, in the last 20 years, they have no invest in the renewal of wastewater treatment plants. The technologies are from the Second World War. So they are very ineffective, and most of the estuaries and coastal areas of the UK, they have very deep environmental issues due to these discharges. In Spain, the technology is what I mentioned 20 years ago, and it was not designed to treat these contaminants. It was just to treat house wastes, so organic waste coming from the houses, from the daily life of people, and they are effective. They are very effective. You have to check how the river in Bilbao was 20 years ago and how is it now. Just because the wastewater treatment plant in Bilbao was built. Since then, the quality of the estuary is improving. So, but we cannot, let's say that they are responsible of the waste that we are seeing after in the pipeline. They are doing the best they can, and the technology is for other types of contaminants.
The technology for other type of contaminants exists, or is it being developed?
It exists, but it's very, very expensive. Think, for instance, if you have to treat a small quantity of mixtures of emerging contaminants that you cannot remove in a classical way in a wastewater treatment plant, you need or ultraviolet light or ozones of peroxides, very hard oxidation processes that require energy, that require reagents, and sometimes they are not 100% effective. They are, let's say, 80% effective, but they are effective if you have a very small quantity of water. If you have the effluent of the wastewater treatment plant, that's unaffordable.
And some of these substances that are getting into the water and could be potentially causing problems are antibiotics, I believe,
Sure.
or antimicrobials.
Yeah, sure.
You work with this
Yes.
and with maybe antibiotic resistance too.
Mhm.
Could you clarify exactly what your research in this field is about?
Well, we are working with a kind of network of researchers at the university. We have a joint research lab on antibiotic resistance. It's led by a biochemist that is working on this topic, and we are different groups working in antibiotics. In our group, what we do is developing the analysis and monitoring of antibiotics and antibiotic byproducts in different environmental scenarios. It can be drinking water, can be wastewater, can be food, whatever. The other groups that what they are studying is how these resistant genes are transferred from bacteria to bacteria. Some others are studying if this appears in, for instance, dairy products, cheeses, yogurts, etc., and in other vegetables. If you are using, for instance, as a manure, as fertilizers, the solid waste of a wastewater treatment plant, which sometimes can be useful, and if we have antibiotics or antimicrobials there, residues of and you put it in the land, they end up in the product you get in the crop. So sometimes it can be dangerous. But it's also dangerous if you treat cows or livestock preventively with antibiotics and without keeping the quarantine before the animals are sacrificed, you put it in market because you can find the antibiotics in the meat or in the fishes in aquaculture. It's an entry import problem. And nowadays, the resistance to antibiotics is becoming a clinical problem. It's not so much an environmental problem. It is an environmental problem, but it's becoming a clinical problem for hospitals.
And regarding that, what's the future we are expecting, or how is it gonna be our future?
Well, it depends on us. What kind of decisions are we able to take together? It's a problem of governance. We have to. That's the hardest problem we have. We have to become fluent and continuously in connection with authorities, the ones that are taking the decisions. And we have to advise them that this is going to be a very serious problem in the near future. And they have other priorities. We know how the politicians work and how every 4 years we have elections, and it's not a good measure to say, well, let's reduce the cars that we are using, let's reduce the energy we are using, let's reduce the antibiotics we are using, let's do it in a different way. It's difficult for them to take the decision, but we have to clarify to them that there are things that should be considered seriously.
And when trying to look for identifying new antibiotics, the marine environment nowadays has an important role, no?
Yes, there are many sources of. There are a lot of bacteria and antibiotics that are naturally found in the environment. But considering this, antibiotics and this is not a kind of product that pharmaceuticals are very interested in, because it's not a profitable product. So that's another problem in the clinical world. Antibiotics, it's kind of a commodity for many companies, and if I'm not wrong, in the last 20 years, there is no new antibiotics in the market because the big companies are not interested in antibiotics. So this is another problem.
I personally didn't know that.
Yeah.
So there could be the chance that the science is there to create more antibiotics. It's just that the money is not being invested, maybe.
Maybe what authorities have to do is to convince to companies to have a kind of, investing in new antibiotics takes 5 to 10 years. Okay, maybe the first 5, 7 years is paid by the public administration, and then we do kind of 50-50, and then you get the rewarding money after some years. This is something that we have to let's say work the creativity with companies and administration. It's not an easy task.
Also, I guess that also we have to change our use of antibiotics
Sure,
and how responsible we are.
sure.
Because if not, if you're constantly creating
Yeah.
a new solution, you're just extending the problem.
Yeah, sure.
Going back to what you're developing is analytical tools to detect these antibiotics. And I guess that depending on what you want to analyze, the methodology changes a lot, or is it rather standard?
For us, if let's put an example, we want to analyze antibiotics in carrots. Okay, and we develop a method. We do our best. We achieved the parameters that are demanded for the method. Okay, and then another customer says, I am not interested in antibiotics in carrots. I would like to do antibiotics in tomatoes. I wouldn't say that I will start from scratch, because I have the experience, but I have to fine-tune the method that I develop to measure the antibiotics in carrots, to validate somehow that is also working with tomatoes, and if not, I have to make these tiny adjustments.
If you could briefly explain some of the methods that you are trying to design here at the Plencia Marine Station. Briefly, so everyone can understand.
Try to explain it to a 14-year-old, maybe.
Well, things that we do, and I can tell you with some detail. For instance, wastewaters. When we sample wastewaters, what we do is we have good relations with the managers of the wastewater treatment plants, and what we get from them is a kind of a composite sample of 24 hours. So there's a machine that they have, and it every 5 minutes takes 50, 100 meals in a big pot. So 1 hour. So at the end of the day, you have 1 liter, more or less, or 2 liters. That is a kind of an average of 1 day. Okay, that's a composite sample. We take the sample. Depending if the sample comes from the influent, so the water that is arriving to the wastewater treatment plant. So it's purely shit, non-treated water. Or the one that is released by the wastewater can be almost holy water. Okay, the procedures are very different. Okay, but basically we filtrate, we remove all the solids, and we extract the compounds that we want to measure. To extract them and to remove all the kind of interfering compounds that are together. Then we purified a little bit the mixture. We concentrate it because the concentrations in the sample are very low. We concentrate it, can be 500 times or 1,000 times, and then we put in one of our instruments. Basically, it's a liquid chromatograph coupled with a mass spectrometer. So we get the fingerprints of the molecule. We have a calibration of the compounds, and we get roughly the concentrations. Basically, the procedure is in this way, as I have summarized, is the same for many different compounds, and it's not for wastewater treatment plants. The details for experts, maybe.
Yeah. Talking again about the wastewaters, I have been maybe half a kilometer away from a wastewater treatment plant, and I could smell it. So what is it like working with these samples? Does it get stinky?
Stinky, yes.
And do you get used to it, or
No?
or do you put something on your nose, or no, nothing? I guess.
No. But let me tell you, there is a worse place to work in. I've been working with a company that treats fish waste to produce fish meal. And if dealing with fish waste, being inside the fabric is a torture.
Long hours in the fabric, or
The long hours.
yeah. So, well, we enjoy a lot knowing about the research that you do, but we also like to know about the personal lives behind the researchers. So, we'd like to ask you a very simple question: what hobbies does Nestor have? What hobbies do you have?
What
in your spare time?
I like music.
Jazz, for example.
Yes, for example, I like going to the mountains. I like playing music, but I'm very bad.
Oh, well.
And
Previous guests we had sang, so maybe you could form a group.
yes,
Manu Soto likes singing.
He
Maybe
sings and I don't play. It can be a terrifying experience. But I like music, but I am happy if I can enjoy listening to the music instead of playing. Can be very painful for the rest if I play.
And following a little bit with the hobbies, it's a question that we do to most of our guests. If you have any book or scientific paper that you are suggesting to the audience?
Suggesting to the audience.
It doesn't have to be scientific, it can be whatever you think.
Now I'm reading a book. Is Bruno Latour is a sociologist, and he is basically he has been working because he passed away some 2 years ago. Sociology of science, and he has some books that are very interesting. One was he was working inside a research group that at that time, it was in the 70s, last century, they were analyzing one peptide that was what later was called somatotropin. It's an hormone. And there were two laboratories, one in France and another one in Canada, that were, let's say, in a race, who was the first one to define the structure of that small peptide with the instruments in the 70s. And he was just looking and studying how the scientists were working. And it's interesting because it's from the other side, how we behave. It's interesting.
How does a scientist behave?
Like any other human being, with all the jealousies, egos, and good behavior and good mood, in any place. As we are not special at all.
Follow-up question. We also ask all of our guests, from your experience, your long time in teaching, etc. What advice, tips can you give to the people who recently finished their studies and want to venture into the world of work research?
This is a very exciting activity. I'm very, I'm happy because I had the opportunity of being part of this life, but it's also a kind of marathon race. I mean, you have to be convinced and pursued very hardly that this is going to be your future and your activity. Because there are many. Not as many as we wish, but there are many students. There are many good students that want to do this research career, and the budgets we have and the means we have are limited. But and most of the researchers have to go away to do the master, as you guys, and then maybe a PhD, and then maybe a postdoc. And this is a kind of endless story that you don't know. You know how it starts, but you cannot imagine how it finishes. It's a very interesting and rewarding activity, but it's difficult. And anyone who wants to do it, I push forward to do it.
So you describe it as a marathon, no? Where
Yes.
some people enjoy doing marathons.
Yes.
And maybe you answered one last question somehow, but do you think that the work as a researcher is well valued or appreciated?
Well, I have a kind of contradictory feelings. I talk with my colleagues that are not scientists, that on weekends I am working, and because what are you doing here in June, July, and September? All the teachers are on vacations. Think, well, they don't know what I'm doing. They are not understanding what we're doing. But I think that there is another positive view. When we passed through this COVID episode, scientists gained the reward or the interest of the lay people, because we were helpful for the society. So in the pools, the scientists gain kind of interest and value. They were appreciated. What we do was appreciated, but it's a contradictory feeling.
So you said that after the COVID, scientists or researchers gain some importance or fame. Do you think that this will last over time, or it will get somehow diffused over?
As soon as other artists or football player or television star appeared under the radar, we will finish.
Well, Nestor, we've come to the end of the interview. It's been quite short, actually, because it's been very entertaining. I've learned a lot of things I didn't know about.
Thank you.
And it was a pleasure having you here. Hopefully, maybe next generations of MER will invite you again to talk about
it will be a pleasure.
Whatever. And, yep, basically that. Thank you.
Thank you very much.
Also, thank you, because you were on the beginning of this project, on the meetings we had.
Exactly.
So you can also be part of this project.
I think I'm pretty sure that this is going to be a very interesting thing for students and for the P as well.
It is. It's certainly being very good for us personally.
Okay.
Anyways,
Congratulations.
thank you very much.